Greetings. Let's discuss today K-Pax, a film that was released in 2001. It's a mystery drama that revolves around an individual named Prot, played brilliantly by Kevin Spacey. Prot claims to be an extraterrestrial from a planet called K-Pax, hence the name, which is 1,000 light years away from Earth and belongs to apparently what is called the Lyra constellation. Prot is committed to the Psychiatric Institution of Manhattan. There, psychiatrist Dr. Mark Powell, played by Jeff Bridges, tries to cure him of his apparent delusions.
I'd like to begin by asking you if you know why you're here.
Of course. You think I'm crazy.
He claims to be not human. Visitor from another planet.
K-Pax.
K-Pax?
It's about 1,000 of your light years away from here.
However, Prot is unwavering when it comes to answering questions about himself, about K-Pax, and its civilization. His medical examination only reinforces his story, as he claims he can see ultraviolet light, and he is completely resistant to an antipsychotic that is well known to us, called thorazine. Dr. Powell later introduces him to a group of astrophysicists who are puzzled and baffled by Prot's ability to provide details about the space constellations and galaxies, which again reinforces his story as someone who is from an extraterrestrial planet outside of Earth.
Doctor. 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 How many doctors are there on this planet?
How could you know this?
K-Pax is quite intriguing and has multiple layers. It dives deep into psychology and mental illness, which is why I enjoyed it even more. And I was intrigued, and my psychiatric brain started to kick in. I was trying to form a diagnosis for Prot. Is he suffering from a dissociative disorder? Or is it a delusion? Or could it be a sci-fi movie where he is actually an alien? I continued watching, and I was intrigued more and more as the plot started to unravel. We follow Prot as he starts to wince all the patients in the mental institute. They all believe him unquestionably that what he's saying is true. And that's where Dr. Powell, again, as I mentioned, played brilliantly by Jeff Bridges, tries to confront Prot about his delusions. And he believes that Prot is actually an alter ego to someone else. So he starts to use different methods other from antipsychotics. For example, he tries to use hypnosis, regression hypnosis, and he unravels certain mysteries. And he believes that Prot is actually the alter ego of another individual who's from New Mexico who tried to commit suicide after his family were murdered by a criminal. So let's talk about performances. Kevin Spacey did a tremendous job portraying the individual Prot, who was having complete conviction in what he says and truly believes that he is an alien. It definitely compels the viewer to wonder and question, is he actually an alien or is he a patient? So definitely only a brilliant actor can pull this off, and I believe Spacey did a wonderful job. Equally, Jeff Bridges played the psychiatrist brilliantly. At the beginning of the movie, you would see him as that very confident psychiatrist who believes he knows what he's doing, but when faced with Prot's case, he is puzzled. He starts to doubt his own assessments and treatment plans, and also starts to doubt whether or not Prot is telling the truth. And I have to say, as a psychiatrist myself, we do come across a lot of cases or individuals, and sometimes we call them patients, that give us such logical details about the history that one fails to understand what's going on and sometimes believes to some extent what they're saying. And this could be a puzzle to any psychiatrist or any psychologist doing his assessment, especially if there is no collateral history from a family or a friend where the individual is brought to us alone and has no one we can contact. And that's why in psychiatry in particular, it's very important to gain history from friends and family, which we called collateral history. So in previous videos, we discussed mysteries, and I believe K-Pax falls into this category. It's intriguing with its mystery. And as I mentioned, it grasps the viewer and make them wonder about the case of Pratt. Now, when it comes to diagnosis, let's discuss what could be the diagnosis of someone like Pratt, given that he's not an alien. Again, my psychiatric brain started to kick in, and I thought he most likely suffers from a delusion. Delusions defined as a fixed false belief that are strongly held despite indisputable evidence of the contrary. And in this case, Pratt is completely convinced he is an alien from an extraterrestrial planet. Another part of the film that I really enjoyed and tackles how do psychiatrists or mental health professionals tackle such cases. Should we confront an individual with a delusion? Should we tell them that they're wrong, that they're not doing the right thing? And see, this is the trick. I believe it depends on the case. Definitely confrontation early on should be avoided because it can disrupt the rapport between the therapist, the psychiatrist, and the patient. And so you want to sort of be neutral, try not to disregard what they're saying, and at the same time, do not take it completely as 100% true. So have to be somewhere in between, and only a skillful psychiatrist or psychologist can attain that. As we move on with therapy, I think at a certain point, confrontation could be necessary, especially when the delusions start to be shakable. Now, keep in mind, the treatment of choice for delusions is usually an antipsychotic medication. So, K-Pax, a definitely recommended movie that has brilliant performances, a very intriguing premise that involves psychology, psychiatry, and mental illness, a stellar cast with Oscar-worthy performances. So highly recommended.